Members of Congress have spent much of the August recess listening to constituents voice opinions on overhauling the nation's healthcare system. But what about medical professionals? Are they happy with the proposed healthcare legislation? That's the topic of tonight's face-off. And joining me now, Dr. Donald Palmisano, former president of the American Medical Association, and now the spokesman for the Coalition to Protect Patients' Rights, and Henri Treadwell, research professor at the Morehouse School of Medicine. Let me first start with you, Dr. Palmisano. You were the president of the American Medical Association. The AMA has actually come out, though, in support of H.R. 3200. Why do you think this piece of legislation will hurt a doctor-patient relationship?
Well, first, let me say that the AMA is a good organization. They just made a mistake endorsing this legislation, H.R. 3200, so early. This legislation has disaster in the details. The problem with this legislation, it really boils down to, do you want, as a patient, do you want to be in control of your own medical care with the doctor as trusted advisor, or do you want the government mandating and dictating your care? And so, number one, there's a public option, as they call it. It's really a government option. And the government has all the money and can set all the rules, like playing a football game. And in the last play of the game, they can change the location of the goalpost when you're ready to kick a field goal. So they will draw the other companies out. And yes, go ahead.
Well, Professor Treadwell, do you agree? Do you agree?
No, I do not agree. There's no evidence that the legislation as proposed would interfere with the doctor-patient relationship. And there is also a concern that people who do not have health care at this point have no doctor-patient relationship, and that's the importance of the legislation. People would eventually have coverage and then could hope to have a doctor who would look after their health care needs. But there's absolutely no evidence that the legislation will interfere with the doctor-patient relationship.
Okay,
well,
if
I might respond. Yeah, go ahead.
Sure.
May I make a comment on that? We already have some experiments that have been performed in the United States with public plans. We have Medicaid, and patients on Medicaid, they have insurance, but it doesn't do any good to have insurance if you can't find a doctor. The government price fixes to the point where the physician can't stay in practice if he takes all of the Medicaid payments. And we have Medicare, which is going bankrupt. So we need a system where the patient is in control, and Professor Treadwell is absolutely correct. We do want to help the uninsured. Let's find out who really is uninsured and help them. We can do that with tax credits. We can do that with vouchers. We can let people buy across state lines. We can do many market enhancements without giving the government control.
I don't think that it's an issue of government control. I think it's an issue of, there are two issues. One is individuals do not have coverage. They cannot get health care. Two, institutions that provide care to individuals who do not have coverage, such as the Morehouse School of Medicine and its clinics, do incur severe uncompensated debt. That needs to be taken care of sooner rather than later. We tend to say we'll take care of the uninsured, we'll find some way to do that in the future. We've been 40 years with Medicaid and no one has found a way. It is time to find a way before we lose the institutions that we have. And there is nothing in the legislation that will hurt. Medicaid payments will increase. Medicare certainly has the financial ills that any institution has in these days and times, but that's because of spiraling costs that are not under control and a lack of emphasis on prevention. And if we can focus on prevention and reduce some of the chronic conditions that cause people to be sick sooner, to die sooner, we can in fact control costs. It can be done, and we can do it in a fair and just way now. 40 years since Medicaid began, and those in the leadership decision-making positions have not yet found a way to fund the poor, the underserved, the underinsured, the uninsured in this nation. The time is now.
Well, I want to jump in here and just ask. Let me jump in here, and I want to ask a question.
Okay.
Okay, all right. Well, we'll get to the issue on cost in just a moment, but I want to ask a question. In terms of doctors and in the future, will this mean a shortage of doctors in the future? Do you think, Dr. Palmisano, that there will be more people maybe reluctant to go into the medical profession if this health care bill goes through?
Absolutely, absolutely. And I teach at Tulane Med School. I teach a seminar on leadership, and I don't find any of the students that are, number one, going into private practice by themselves. The burdens and the costs are too great, and they have med school debt. And I find more and more students saying that it really looks ominous for them. It's a wonderful profession, a healing profession, and what we need to do is encourage people to go in medicine.
That's not the experience at the Morehouse School of Medicine. Lots of applications, and we train the students for primary care. That is what they want to do, and that is what we train them to do. And there is no shortage of applicants.
All right.
Well, in the bill itself, okay. Oh, wait, well, let me just say about the cost issue.
Okay, you get the last word on cost, and then we're going to have to end there.
Right. We can fix the cost issue by letting people buy across state lines. But the reason we have not even mentioned medical liability reform in this bill, that costs billions of dollars in defensive medicine. And what we need to do is let everybody own their policy. And don't discriminate against the people on Medicaid anymore or Medicare. Let them own their own policy. Give them a defined contribution or voucher. That's the American way. Free enterprise system. It's a privilege to be with all of you. Thank you very much.
We are going to have to end there, but very much appreciate the discussion. Dr. Donald Palmisano and Henri Treadwell from Morehouse School of Medicine. Thank you both for joining us.